On YouTube, I watched a video on weight loss. It had 2 million views, 20 lakhs, and thousands of likes. The comment box was filled with praises like, "This video has opened my eyes. This is better than going to a doctor." But as soon as I watched it, I was convinced if even a small percentage of people follow this advice, some of them are going to end up in hospital, maybe even in ICU. Let me ask you a very simple question. If a video goes viral, does that make it true? My name is Dr. Uttam Shiralkar, and honestly, I wasn't keen to make a video on this topic. Then I could not keep silent after seeing other videos like this. I worked as a surgeon and later as a psychiatrist in India, the UK, and the USA for over 30 years. And now, when I see people making serious medical decisions just because forwards or social media posts, I said I had to do something about this. In India, we joke about WhatsApp University, but the scary part is some people are graduating from it and they treat their diabetes, blood pressure, thyroid, even cancer based on forwards and social media posts. Most people can't tell the difference between useful information and dangerous misinformation. Can you? Let me give you a few numbers. Research showed that up to 67%, two-thirds of health or fitness websites gave inaccurate information. But then social media takes it to another level because it spreads through emotion and trust. You see this when people justify it by saying, "Oh, my uncle tried it. My neighbor said it works." World Health Organization report says up to 51% of posts about vaccine had misinformation. And YouTube, yes, YouTube, the one you are watching, is found is found to have around 30% inaccurate or misleading videos on infections. Now, here is the uncomfortable question. When you watch a video on health or fitness, how do you know whether you are in safe 70% or the dangerous 30%? You don't have to answer because I'm going to give you some practical solutions later. But first, you need to understand the real danger. One study reported that about half the people who get online health information actually change their decisions about health or about medical treatment because what they read or watched. They stop medications, they delay proper treatment, they try natural cures first, and I have seen the consequences. Not on mobile or computer screen like this, but in real patient bodies. People who waited too long because they were trying just one more remedy. Families who came late because they were told by a non medical influencer, "Don't worry, it's not serious." But then the bigger question is, why do even intelligent people fall for this? That brings me to my story. I started as a surgeon, and the operating room taught me that our body doesn't care about what the social media says. It doesn't care about number of views or likes or if the speaker is convincing. As far as our body is concerned, either a treatment works or it doesn't. I have operated on people who came late because they tried internet cure first. Sometimes we could fix the damage, but then sometimes we couldn't. I understand the reality of human body, what disease actually do to the body and how treatment works. This was the first part. Then I had a car accident, ended my surgical career. But then I retrained as a psychiatrist, and that's when I finally understood the other half. As a surgeon, I saw what happened, but as a psychiatrist, I started understanding why it happens, why fear spreads, why miracle cure feel believable, why doctors are hiding the truth is such a powerful conspiracy theory. And that combination, surgery plus psychiatry, is why I'm making this video. Let's talk about the elephant in the room, WhatsApp. WhatsApp has hundreds of millions of users in India. According to a report, over 400 million or 40 crore users are in India using WhatsApp. And that same study found that older adults, that is over 65, were among the most vulnerable to false information on WhatsApp. But then, here is the really clever trick used by those who want to spread health related misinformation. It often includes a link or a source to appear it official. So if someone forwards something and says, link is there, that does not automatically mean it is true. Now, the question is, what do we do about it? On this channel, I'm going to tell you a simple set of tools. So, no one gets panic. On the contrary, you will help someone to calm down. And you don't have to waste time in thinking or searching a lot about it, about what to do. For example, I will show you how to verify whether a doctor online is actually registered in India using Indian Medical Register search. Then I will tell you my 3-question filter. Before you believe any health claim, what exactly is being promised? Then I will tell you my 3 filter question. Here are those questions that before you believe any claim, first question, ask yourself, what exactly being promised? Second, what evidence is shown? Don't believe in stories, evidence. And third question, what harm could happen if it's wrong? Then I'm going to tell you what you need to know about how misinformation uses our psychology, how they play with our mind. You can suspect that when you see the terms like share urgently, when the WhatsApp message shows authority, like I'm from so and so hospital, and they try to make you feel guilty. You have to do this, or you don't care about your family. I'm also going to tell you how to handle WhatsApp forwards politely, how to respond without insulting others, without blindly agreeing either. And yes, we will do myth busting with a twist, because I won't only tell you what is wrong. In the following videos, I will also explain why your brain wants to believe it. We will cover things you see every day in Indian families, like diabetes can be cured fully with Karela and methi, or one special powder. Steam or kadha will prevent everything. I will explain what's reasonable, what's risky, and what's simply fake. And I will show you how to decide without becoming either cynical or blindly trusting. This channel is for you if you have ever Googled symptoms at 2 o'clock in the morning and then spend the night worrying. It is for you if your WhatsApp group is full of health forwards and you don't know what to believe. It is for you if you have watched 2 experts says opposite thing and thought, what should I do? Whom should I trust? And it is for you if you got tired of being manipulated by fear. But then I need to say one thing clearly. I'm not here to sell supplements. No link. There won't be any link in the description or miracle powders. I'm a doctor who has seen enough preventable harm to know that health education is not optional anymore. It is the protection, better than insurance. And I'm not asking you to trust me blindly. I actually want you to challenge everyone, including me. Internet is not going away. WhatsApp is not going away. Health misinformation is not going away. So we have only 2 choices. We can stay confused or we can get smarter. I have spent years in learning how body works and years learning how mind works. Now I want to help Indian families, people, safer, smarter decision with clarity, not panic. Thanks for watching.